on opioid data, and last year, the age-adjusted rate per 100,000 population for overdose deaths was highest in Ulster County. In Dutchess County, which is where I reside with my family, opioid overdoses have increased 83% since 2016. These are staggering numbers that reiterate the need to address this crisis with every tool we have at our disposal. These numbers just begin to tell the full story. I have discussed this crisis at length with my healthcare advisory committee, which includes voices from all 11 counties in the district. And as I've held 26, I think, town halls at this point, it comes up repeatedly. And my heart breaks every time I am confronted with a constituent, be it a mother, a sibling, a father who has had to endure the pain of loss to addiction. This in-district work week, I have decided to focus almost entirely on this crisis, and I've been hearing from folks all across the community who are working on the front lines, doing life-saving work to respond to overdoses, treat those in recovery, and hear from patients about living in recovery from addiction. And you all, I should know that, as I'm sure most of you are aware, these are brave souls who I've been able to engage with and interact with. And our community is important to know, and part of this discussion is to highlight the resources, is home to a number of resources doing life-saving work to treat those recovering from substance abuse. This week, I've had met with the leadership and medical professionals to see their substance abuse treatment centers at Ellenville Regional Hospital, where I met with panelist Ms. Ashima Butler, who I can tell you is amazing and is doing incredible work on the front lines there. Also visited the Monticello campus of Catholic Charities of Orange, Sullivan, and Ulster County, Sullivan County, where I sat with and saw the work of Dr. Dean Scher, who I can also tell you is doing amazing work on the front lines. I also got to sit and meet with individuals who are in recovery to hear the stories that they bring to bear and the work and how critical the work that Catholic Charities is for them in providing a support network and a system not just on the site but critically in the surrounding community. I think that is of utmost importance. On Tuesday in Delaware County, I had an important discussion with leadership from veterans who are dealing with an important piece to this entire puzzle. You have veterans who, on the one hand, are sustaining critical injuries that bring about chronic pain, that there's a real need for opioid treatment. And then you have other veterans who are struggling with some of the fallout of going through a pretty traumatic experience and striking the right balance, as I have learned with friends like Andrea Minter, who I see here today, striking the right balance between making sure that we hold those accountable who have made a business of overprescribing these drugs that are highly addictive against the need of those folks out in our community, be it through disability or through chronic pain, who need these drugs. They should not be the ones who feel the fallout of this course correction. And so I think it's important to always flag that balance as we have these conversations. In the previous in-district work weeks, I've met with parents who have lost loved ones to addictions at the Samaritan Daytop Village Residential Treatment Program in Ellenville, to meet with patients in the Mid-Hudson Valley, including a focus on women veterans seeking treatment for substance abuse. Our women veterans are the fastest growing class or subset of homeless in the country. And the suicide rate among women veterans is, we're talking about 200, 300% higher than other groups of individuals. So a real need in that space as well. My discussions this week and previous months reinforce that addressing addiction requires a multi-pronged approach. This approach includes support for those living with addiction through medication-assisted treatment, destigmatization of the addiction with more focus on drug courts rather than treating incarceration as a form of treatment, holding Big Pharma accountable, as I noted, for the overprescription, and of course, balancing that accountability against making sure we meet the need of those who are suffering from chronic pain. I think that's a critical point. I just want to walk through some of the legislation that we've been able to work on that I think is important in this space. This spring, I joined my colleagues on both sides of the aisle to introduce legislation to address access to treatment for addiction. The bill, the Mainstreaming Addiction Treatment Act, would lift special waivers that are now required for physicians to prescribe treatment, buprenorphine, Suboxone, things that we know the science has proven can help folks work their way through addiction. I would say part of the reason why this special waiver, and just so we're clear, there's no special waiver needed to prescribe the highly addictive opioids, okay? But there is one to prescribe the medication for the treatment. This is born out of stigmatization. And we have to allow and enable our physicians and empower our physicians to tackle this addiction for what it is, which is a disease. So that bill hopefully will work its way through the House. We're working very tirelessly to do that, and I think it'll save some lives. I really do. I also want to flag another bill that I introduced or co-sponsored called the Opioid Workforce Act. Another bipartisan bill that will provide Medicare support for an additional 1,000 graduate medical school residency positions over the next 5 years in hospitals that have or are in the process of establishing accredited residency programs in addiction medicine, addiction psychiatry, or pain to combat the opioid crisis across this country. So making sure that we continue to provide support for those hospitals at the local level who are on the front lines doing this work. I will continue to push legislation in any form or fashion. And I think part of the conversation here is to generate more and more ideas in this space. As we will discuss today, legislative solutions are one element of combating this issue on a local, state, and national level. I look forward to hearing from our panelists about their insights into how we can address this crisis and the resources that their organizations are providing. With that, again, I thank all of you for coming. It is a real pleasure to see the turnout here and understand how important this issue is. And I now want to introduce our first panelist, Schoharie County Sheriff's Department Investigator Bruce Baker. The Schoharie County Sheriff's Department recently joined the Law Enforcement Assisted Diversion, or LEAD program, and I was proud to join them this January as they announced their involvement in this program designed to give police flexibility when dealing with individuals struggling with substance abuse or disorder. So, Bruce, thank you.